it going?
I'm doing good.
Good. Well, my name's Sean, and I'm going to be your student nurse today. The doctor has ordered a head-to-toe assessment, which means that I'm going to check you out from the top of your head to the tip of your toes.
Yes, ma'am.
During this assessment, I'm going to be putting my hands on you, and I'm going to push on you a little bit, and just check you out and figure out what's going on. Is that okay?
Okay.
Okay. I'm going to start by washing my hands. I shut the door behind me so there's nobody else in here, but I'm going to pull the curtain just to give us some extra privacy. Can you tell me your name and your birthday?
My name is Nate, and my birthday is August 23rd, 2013.
Okay, and do you know what month it is?
It's July.
July, and where are you?
The Graceland Hospital.
Awesome. So you are alert and oriented by 4. So I'm going to go ahead and mark that on my chart. And your name and birthday adds up with what I have, so that's great. So to start, I'm going to get a set of vital signs on you. Is that okay?
Okay.
Okay, so I'm going to go ahead and touch you. I'm going to get your temperature. 98.6. I'm going to feel for your pulse. Your heart should be beating 60 to 100 times in 1 minute. And while I'm doing this, I'm going to watch your chest and count how many times you're breathing. And you should have 12 to 20 breaths every minute.
Yes, Mom.
Okay. Everything feels good. I'm going to take your blood pressure. I would wrap this cuff around like this. And I'd blow it up and I would listen to count or to hear how your blood is going. Usually you want it to be 120 over 80. So you're probably just fine. I'm going to say you're 120 over 80. Let's see. I'm going to give you my pulse ox. Have a finger, please. Thank you. It's 99%, looking good. On a scale of 0 to 10, 0 being no pain at all, and 10 being like the worst pain you've ever felt, are you in any pain right now?
7.
There's 7? Okay, where are you having some pain?
But my thumbs are really hurting.
Okay.
Mainly on this thumb.
This thumb, and where about on your thumb does it hurt?
Like on my joint and at the bottom of my thumb.
Okay. Does it hurt more in the morning or at night or
and
at the very top? Okay.
It hurts mainly at like 3 o'clock through 5 o'clock.
Okay. And then does it feel worse when you're moving it? Does it feel worse when it's still?
It feels worse when I move it.
You're moving it? Okay. Well, I will make a note of that and then we can follow up with the doctor, okay? Okay. I'm gonna have you look in my light. Actually, look right here. Follow my pen with your eyes. Perfect. And then look at me, please. Perfect. So your pupils are equal, round, and reactive to light and accommodation. That's just what we want. Go ahead and mark that off. Can you give me a big smile? Nice, and a frown. Good. So your face, your muscles in your face are moving at the same time, which means that they're symmetrical, and that's just what we want to see too. Last, I'm gonna give you my fingers and grip me hard, but don't hurt me, okay? Perfect. All right. So you're answering my questions just fine. You're talking, you're understanding what I'm saying. So I think you've got, you're doing great.
Thank you, ma'am.
You're welcome. So now, oh, careful. Now I'm going to look at your skin. And I'm gonna start with the top of your head and I'm gonna work all the way down your body, okay? Okay, I'm gonna start with your hair and check out your scalp. Do you have any wounds or scars or tattoos that I need to know about?
At the bottom of my eye.
Okay. And that looks good. The back of your neck looks good. Can you look to the right for me, please? Turn your head and look to the left. All right, look right back at me. Can you give me a smile? And then swallow. Good. Everything looks normal right here. I'm just going to feel for your lymph nodes. There's no swelling. I'm going to feel for your pulse. All right, looks good.
Thank you, ma'am.
You're welcome. All right, now I'm going to look in your nose. Can you give me a big sniff in? All right, blow out your nose. Blow out. Have you had any like runny nose or stuffy nose or anything like
I've had a lot of runny noses and a bad cough.
Okay.
Oh.
Sleepy today, huh?
I am.
All right, okay. I'm going to have you sit up. Oh, I'm sorry. Sit up for me, please. And okay. Put your head back, please. Thank looks good. I don't see any mucus or any redness. You're 9 years old, so you're losing some teeth right now, right?
Yes.
Okay, so you probably have a couple that are missing.
Yes, and these two are growing in.
Okay. Do you go to the dentist every 6 months?
Yes.
Okay.
And this tooth like is starting to hurt.
Okay. All right, we'll go ahead and talk to the doctor about that. Can you open your mouth for me, please? Thank you. Yep, you got a couple missing. Say ah. I don't see any redness or mucus or white patches at the back of your throat, so that's good. Go ahead and look to the right for me again. I'm going to check out your ears. Okay, and then look to the left, please. Does it hurt at all when you're turning your head like that for me?
Yes.
It does hurt? Okay. Go ahead and make a note. I'm going to give you a little pinch right here. It's just not going to hurt that bad. I'm just checking. Oh, that bounced right back. I'm checking the turgor of your skin. That's telling me if you drink enough water, if you're hydrated or not. So go ahead and keep your arms out for me. I'm going to check your arms. The skin on your arms is warm, dry, and intact.
That good?
That's good. If you had a gown on, I would open your gown up and I would look at the skin on your chest. Just make sure you don't have any moles or lesions or anything that shouldn't be there. Go ahead and stand up for me, please, and turn around. Also, if you had a gown on, I would check out the back of you at this time. Again, make sure you have no lesions or moles that look suspect or anything. Check out your trunk. I would also check out your butt and make sure you didn't have anything going on there. The back of your legs, everything looks good. Go ahead and turn around for me and have a seat. I'm going to check your legs. Everything looks good. Your feet look good. Your toes look good. Check out the bottom and your heels. Everything looks good. I'd also check out your groin area. And just remember that when you're at the doctor, it's okay for the doctor and the nurses to look at your private parts. And for your mom and dad, maybe if you have something going on at home, to look at your private parts. But we don't ever show strangers. We don't show our friends. We don't take pictures. That's a private area, right? And if anyone ever does try and talk to you about that you know is wrong, you're gonna talk to your parents, right? Okay. All right, so your skin looks good. Can you take a big deep, can you sit up for me, please? And take a big deep breath. All right, so your lungs are moving at the same rate. That's what we want to see. Have you had, you said you had a cough earlier? Is it like, is it like, or is it like, oh, wait, so you feel like there's stuff coming out from it?
Yeah.
Okay, that's good. You want to move that stuff out. All right, I'm going to go ahead and listen to your lungs. If you had a gown on, again, I would put my diaphragm right on your skin because that'll help me hear a little bit better. Go ahead and sit really straight up for me. Okay, go ahead and breathe in and out, and again, in and out. I'm going to have you keep doing this pattern as I go down and listen to all the different parts of your lungs. Thank you. What I'm doing here is I'm listening for anything that's adventitious. Cracking, wheezing, sounds that we shouldn't be hearing. Can you go ahead and turn your knees all the way over here for me? And can you raise your arms above your head, please? Thank you. And again, you're going to breathe in and out as I move my stethoscope down and just listen to all of the different aspects of your lungs. Go ahead and keep moving your knees all the way that way. Keep moving. Thank you. I'm going to listen to your back. Same. I'm going to listen for one full inspiration and expiration, and I'm just listening for anything adventitious, anything out of the norm. Go ahead and swing your legs all the way around under the desk, please. And one more time, sorry, arms up. Thank you. We're gonna listen for one full inspiration and expiration. Okay, turn back to me. Thank you so much, you're doing great. Do you have any questions before we keep going?
No.
No? Okay, go ahead and sit up straight for me. Move this pillow so you're a little bit more comfortable. Go ahead and have a seat. All right, so now I'm gonna listen to your heart. What I'm listening for here is to hear it move at a rate and rhythm that's normal and even, okay? So I'm gonna start right here. I'm gonna listen to your aortic valve. I'm gonna listen to your pulmonic valve, your Erb's point, your tricuspid, and your mitral. And everything sounds good, so we're gonna keep going, okay? Can I see your hands, please? Thank you. I'm gonna check your fingers. Everything looks good. You don't have any sort of clubbing. Looks like you might bite your nails, but that's okay.
I'd never bite my
Don't
nails.
bite your nails. Okay, good. Don't see any swelling. You've got good capillary refill. You want less than 3 seconds. Pretty much bounces back. Can you go like this for me, please? And can you go like that for me, please? Okay. Now we're gonna do your feet. I already felt for your radial pulse earlier, so I'm not gonna do that again. But your feet, your toes, where you refill right away. You don't have any edema. You don't have any swelling. Can you flex your feet for me, please? Pull your toes all the way up to your head, like that. Can you pull them any further back, back, back?
No.
Okay, now I'm gonna put my hand behind your, okay, and then flex your foot. Do you feel any pain behind your knee when I do that?
No.
Okay, good. And then again on this side, any pain behind your knee when I do that?
No.
All right, so everything is good. Again, you don't have any swelling, you don't have any pitting. Your capillary refill is under 3 seconds, so you've got some good vasculature, so that's great.
Okay.
Now I'm gonna listen to your stomach, okay? I'm gonna listen to all 4 quadrants. I'm gonna start in the right lower quadrant. I'm gonna listen for 3 to 5 minutes in each area. What I'm listening for is active bowel sounds. That means you've got good peristalsis, means things are moving. And I'm gonna hear 5 to 30 clicks a minute in each of those quadrants.
Alright.
So again, I'm gonna listen for 3 to 5 minutes in each of those spots. And everything sounds good. Now I'm gonna palpate, or I'm just gonna push a little bit on your belly. I'm sorry, on your stomach. And if it hurts, please go ahead and tell me. Have you had any sort of pain or anything in your stomach?
Not a lot.
No? I'm just feeling for any lumps or bumps or masses, anything that shouldn't be there. Do you have any tenderness when I touch your stomach like this?
What do you mean by tender?
Does it hurt? Does it feel
A little.
a little bit? Okay. I don't feel anything. You don't have any masses, no bumps. Do you follow any sort of special diet?
No.
No? Okay. I'm gonna ask you some personal questions, but I just need you to be super honest with me, okay? So, do you remember the last time you peed? Do
Yes.
you remember what it looked like? What kind of color?
White.
It was clear?
Clear.
Okay. How often do you go pee during the day?
Thrice.
3 times?
Mhm.
When you have the urge to go pee, are you able to jump up and get to the bathroom right away?
Yes.
Awesome. Does it hurt? Do you see anything in your pee when it comes out? Is it cloudy?
No.
No? Okay. And you have no pain when you pee?
I have no pain.
Awesome. Okay. Do you remember the last time you pooped?
No.
You don't remember the last time you pooped?
Actually, yeah.
Okay. When's the last time you pooped? 2 days ago?
Yeah.
Okay. Was it pretty normal for you?
It was normal.
Normal? It was the right color?
Right color.
Was it hard for you to get out?
No.
No, you were able to just get to the bathroom and poop when you needed to?
Yeah.
Okay, that's good. That's what we want to hear. Okay. So throughout your head to toe assessment, I've had you look up and look down and lift your arms and move your body. You said your neck hurt a little bit.
Yeah.
So I've kind of gotten a feel for your range of motion. Last thing, I'm just going to have you stand up for me, please, and turn your body that way. And then reach down for your toes, please, if you would. Thank you. I'm just checking to make sure that your spine is growing the right way that it should. You can go ahead and stand up for me.
Oh.
And then have a seat in my chair again, please. Thank you so much. You're pretty young, but did you use any sort of cane or a walker or anything to help you get around? No?
No.
Okay. Well, do you have any complaints since we started? Do you have any questions?
No.
Nothing?
Nothing.
Okay, great. Well, again, my name was Sean, and I'm going to go ahead and wash my hands as I leave the room today. I'm going to put your bed in the very lowest position. I'm going to raise your side rails up, and I'm going to give you this call light. If you have any questions or concerns, go ahead and push that, and someone will come in and talk to you. I'm going to take all the information that I got from you today, and I'm going to go document it and get it up to the doctor so we can figure out a great plan to take care of you, okay?
Alright.
Does that sound good?
Yeah.
Okay, I hope you start to feel better really soon, and we'll see you in a little bit, okay?
Yep.
All right, take care.
Beep. Beep, 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 beep.